Israel, kaba Egypt, kaja Ethiopia, kaja Sudan, waja shong. Kaja Ikushima, wani me kona me waja shong. So Timbuktu, Ghana, Mali, Sumanguru, waja shong. Waja jage, waja shong.
Enjoy some fabulous rewards. Get a cool £10 reward when you receive £100 or more from the UK. Tell your friends and family in the UK to send money to your mobile money wallet or bank account using Express Pay and get an extra £10. Terms and conditions apply.
Good evening, ladies and gentlemen, and welcome to the 7th edition of the Ghanaian Community Forum. My name is Emmanuel Kwesi, Chairman of Ghana Union, and will be your host today. Today's program is about the vaccines, all concerns, all issues, all anything you want to know. Basically, we're hoping that by the time you leave here, you will be abreast with all information that you need. If you're considering under 40 years and below and you want to take it, and even if you are above 40 and you still have some concerns, it's a platform to ask your questions. We will also take you through some travel information. Those of you who are frequent travelers to Ghana, and where possible, if we have any, we can make effort to answer questions that may not necessarily be Ghana, but within the ECOWAS states. Where possible. But our focus today on travel issues will be for Ghana. This program has been put together with the support of the Ghana Nurses Association UK, the Nightingale Nurses Association UK, the Western Region Association of Nurses UK, and of course the Ghana Union. It is in partnership and under support by the Ghana High Commission UK, Omega Live TV, and sponsored and promoted by Express Pay. All you need to know is to log on to Express Pay, download the app, and send money to your family and friends, and you will get a cool £10 to whatever you send to Ghana. A few rules will apply this evening. I want to make it clear from onset that this is not a political platform. Panelists will address issues that are vaccine related or travel related. They will not be stating any position of government either here in UK or in Ghana. And so I am hoping that, yes, we welcome your views and your questions, but you will go straight to your point and ask questions that are related to the discussion today. Obviously, where there are no information to give, I'm sure my panelists will go and get information and will give it to you. But we will not be going into partisan interest as to government policies and why this and why that. I hope I'm clear with that. If we come across someone who is taking us out of context, I'm sure the technical team will do the right thing and mute you quite nicely. We ask that when you are speaking, where possible, if circumstances allow, you will show your face so that we can see who we are engaging with. In the course of the program, please feel free to put a chat or message on chat and use your Zoom icon to raise your hand if you want to ask any questions. We have a series of questions sent in already, and after a few presentations, we will go straight to the question and answer sessions. Today I have with me panelists who have taken time off their busy schedules to be with us and take us through question and answer sessions. Our first panelist for today is Dr. Abdul Zabaru, who is a GP in Southport, Merseyside. Dr. Zabaru's passion is empowering people to improve their health and well-being. Dr. Zabaru, good evening and welcome to the forum. He's been with us before and he's, come back again to help address some of the concerns. So we are very grateful. Our second panelist today will be Efa Moti, who is a prescribing advisor and has worked in NHS hospitals for over 30 years. He started working in district general hospitals and has in the last 10 years worked in hospital appointment as a clinical trials pharmacist in oncology. Efa, good evening and welcome back again. This is our third time or fourth time. If I've missed anything, feel free to let us know when we let you on to speak. But it's good to have you back, spending time with us again. Every effort you make is very appreciated. Thank you so much. We also have with us Mr. Eric Prempe, who is the Customer Services Manager at Ghana Airport Company Limited. Mr. Prepra is in charge of customer service with all the Ghana airports, either internal or external. So we have the right person who will take you through travel issues this evening. Mr. Prepra, thank you so much for coming. I'm very grateful for your support. And I'm sure by the time our audience leave, they will be well informed of the things they need to be aware or expect to see when they arrive or depart from Ghana, and even internal air travel areas. We had hoped to get Mr. Ekwesi Awia Abebio today, who is the Director of Diaspora Affairs, but unfortunately at the very last minute, he just called to say he was on the same assignment away from Accra and the connectivity is so bad he hasn't been able to log on. I'm sure in the course of the program, if he managed to get himself somewhere stable, he will join us. So I will let you know once we get Mr. Abebio on board. And so without much ado, the first section of this program will be about Q&A. Our panelists will not be making any formal presentations, but they will just make an opening statement. And they will be focusing on the science or facts or myths or anything that you have about the vaccine. And then Mr. Prempe will take us through the travel aspect. So at this point, I will welcome Dr. Abdul Zabaru to give us an opening statement. Welcome, Doctor.
Good evening, everybody. It's a pleasure to be here tonight to have an important conversation around the COVID vaccine and also around travel. I've done a few of these events now for various communities, and a lot of the questions are around the safety of the vaccine and the effectiveness of the vaccine. I have to say that a lot of the conversations have changed a little bit now. In January, February time, when we were talking about safety and effectiveness of the vaccine, a lot more people were skeptical over the vaccine. There were concerns about safety, there were concerns about effectiveness of the vaccine as well. The conversation is slightly different now. I mean, millions of people in the UK have had the vaccine. The effectiveness, it's astonishing, the effectiveness of the vaccine. We're not seeing people going into hospital. We're not seeing people unwell as a result of COVID now. So that's all I really wanted to say. I just wanted to leave enough time so we can have any important questions and conversations around the vaccine.
Thank you very much. If I may welcome Efa Moti as well to make an opening statement, please. Efa, please take over.
Thank you. Good evening, everyone. So happy to be here again. Yes, I've also had, my name's Efa Moti. I am a pharmacist and I've been working in primary care now for over 20 years, so advising GPs on prescribing issues. And I work in Haringey. You know, we have a lot of deprived area. We have Tottenham, Wood Green area. We've had a lot of conversations with people in the community about vaccines there. Uptake among the Black community has gone up a bit, but it's nowhere close to our other ethnic groups in Haringey. So we continue to have these conversations. And the vaccines, as Dr. Zubaru has said, have been amazing. They are really working. They're keeping many people out of hospital, preventing illnesses. And unfortunately, those who are being admitted to the hospitals right now are those who haven't been vaccinated, or maybe sometimes had just one dose. So I'm here again to answer your questions if you have any concerns, especially around young people, because we feel that if they catch COVID, they will do okay, so they probably don't need to be vaccinated, but we will have that conversation. So do feel free to ask questions as the evening goes on. Thank you.
Thank you very much, Ifa. Thank you so much. At this point, if you don't mind, we will go straight to the one with the presentation about travel, so that we can open the whole forum to everyone when it comes to Q&A. So may I introduce to you Mr. Eric Prempeh, who is here to share some information, key information about travel to Ghana or returning from Ghana to UK. For our audience, and then we'll come back to Q&A. I have lots of questions for the vaccine group, and I'm sure enough for Mr. Prempeh as well. Mr. Prempeh, please take us over and give us an opening statement and the rest of your presentation, please.
Okay, all right. Good evening, everybody. Thanks for the opportunity to be on this platform. I'm glad to be part of this August platform. Tonight, I'm going to just do a short presentation on the arrival and departure processes at Kotoka International Airport. I believe since this influx of COVID, I mean, customers and passengers are some really don't have information about the kind of processes that goes on within the aviation industry. This evening, I'm going to throw the arrival at Kotoka International for 20 minutes. Then the next 10 minutes, I'm going to hand over to a gentleman from Panabios, that's Pan-African Biosystems, to throw more light on some new measures that has come up that will really help passengers in their travel engagement. My presentation, I'll talk a bit about the
I think we
few health protocols. My colleague will also talk about the biosystems and answers. Hello?
We can hear you. It does break a bit sometimes, but we can manage that.
Okay, all right. Okay, so our vision is to position Ghana as a preferred aviation hub and a leader in airport business in West Africa, with a mission to provide world-class airport facilities and services to the benefit of all our stakeholders. So we manage International Airport, Kumasi Airport, Tamale, Sunyani Ho, and Wa Airport. And to let members be aware, KIA, our international airport, is part of the ACI ASQ program. ACI is Airport Council International. It's one of the recognized bodies within the aviation industry. And ASQ is Airport Service Quality Program. And KIA is part of this program for the past 2-3 years. And this program is a world-renowned benchmarking program that measures passenger satisfaction anytime a passenger is using an airport. And mention the top 5 the top 85% of the world top airport are under this program. The Munichs, the Schiphos, and the Shangis, all of them are under this program. And to let members be aware, KIA received an award for 2019 for the best airport by region and size in Africa, when you're talking about 2 to 5 million passengers in the area of customer experience. Also, last year, 2020, KIA was also awarded as the best airport by size in Africa again for 2 to 5 million passengers. So let me quickly go through the arrival requirements as part of the updated guidelines as at 8th of February. I'm going to outline a few processes, the precautions and the protocols that has been put in place so that at least passengers and customers will be well informed about their requirements when they want to embark on international travel. So number one on the requirement, pre-arrival guideline number one is that every passenger who wants to enter Ghana must possess a COVID-19 negative PCR test from an accredited lab in the country of origin. The test should have been done not more than 72 hours before the scheduled departure from the country of origin. And also, secondly, the passenger must not have any suggestive symptoms of COVID-19, including body temperature above 38 degrees. Also, arriving passengers are required. And please let me emphasize on this area again. Arriving passengers are required to complete an online health declaration form using the portal https://ghs-adf.org 4 to 8 hours before boarding the flight. So before you land on the shores of Ghana, it is important that you've gone to this portal 4 to 8 hours before boarding so that you complete this health declaration form. And also the next on the protocol is that all arriving passengers will undergo mandatory COVID-19 testing upon arrival. And the cost will be borne by the passenger. So if you are Ghanaian or an ECOWAS citizen, you pay $50. All other nationals pay $150. And before you touch down on the shores of Ghana. So payment must be made at the portal, and a proof of payment will have to be shown to the airline before boarding. So before boarding, even at Heathrow, if you're coming from London, obviously the airline will have to see your proof of payment before you board. Fifth on the guideline is that airlines that board passengers without this PCR test, which is mandatory by law, will be sanctioned and they will pay $3,500 each by the state. Non-Ghanaians will be forced or may be refused entry and returned to their point of embarkation at the cost of the airline. And Ghanaians will be allowed entry, but they will be subjected to 14 days mandatory quarantine at a designated facility. So it means before you enter into the shores of Ghana, you need to have a negative PCR certificate. Also, airlines that board passengers without a proof of payment for the COVID test. Also, upon arrival, if the passengers come out that they cannot pay, the airline will be surcharged, $3,500. Non-Ghanaians may be refused entry and returned to the point of embarkation. The Ghanaians will have their passports seized. Passengers will be handed over to the state security agencies and they will undergo 14-day mandatory quarantine. This at the cost of the passenger. Also, all arriving passengers who test positive for COVID-19 will undergo mandatory isolation and treatment at a designated health facility or isolation center at the cost to the passengers, except Ghanaians. All arriving passengers will also undergo mandatory screening at the airport. Passengers who test negative will continue their journey home, and they must also ensure they follow all the health COVID-19 protocols outlined by the state That is the wearing of nose masks, sanitization of your hands, and the observing of social distance. Traveling with pets to Ghana is allowed in line with the guidelines of the veterinary services and the Ministry of Food and Agriculture. So you can travel with your pet during this pandemic era. So let me highlight just an overview about the whole arrival journey. Should you arrive at Kotoka International Airport? So once you disembark, you've already made your payment, online payment. So you proceed to the bank to verify your receipts. Immediately after the verification at the bank, your sample, you proceed to the sample center at the upper arrival section of the terminal, where you undergo the COVID testing, which is mandatory for all passengers. So after taking your sample, you proceed to the Port Health 1 section at the lower arrival of the terminal. And this side, I'm going to highlight in my next slide what you should expect at each stage. So after Port Health, you proceed to immigration. You undergo through the border control protocols. You pick your luggage from the carousel. Then you move to the resort center. So if in case you are negative, then you proceed to customs and you continue your journey home. If you're positive, you will be clinically assessed. There's a clinical assessment center at the arrival hall where a team of medical doctors will assess your situation and will decide whether to take you to a treatment center or you will undergo isolation, which is 7 days or more. So let me outline some few steps that you should expect during disembarkation. Passengers will be disembarked in barges to reduce congestion at the upper arrival concourse of the terminal. All passengers before you enter the terminal are mandated to wear masks and also sanitize their hands before entering the terminal. Passengers will be required to complete the health declaration form, which I stated before. In case you missed it at maybe Heathrow, maybe you forgot to complete the health declaration form, we have free Wi-Fi at the terminal, and also you can use your phone to fill the form, or we've provided some tablet stands so that passengers can use the tablets to complete the form. So after disembarkation, you proceed to the bank. The passengers are required to make payment before arrival. So once you get to the bank, what they will do is they will verify your receipt and they will issue you a unique barcode. So once this unique barcode is issued, you will proceed to the testing center to take a sample for your COVID test. Passengers who could not make the payment online will proceed to make payment at the bank. The most of payment at the bank, they accept cash, dollars, pounds, euro, and Ghana cedi. And also, if you have a Visa card or MasterCard, they have point of sale devices there that you can use your cards to pay. They also accept mobile money. So if you have a mobile money account, that's the number that you can send the mobile money to the bank, which I've highlighted in the presentation. At the end of the presentation, certain areas of the presentation will be emailed to the moderator so that at least those who require further information can have access. And also, third party can make an online payment. Sometimes the passengers outside maybe will have challenges maybe accessing the portal. So if you have a relative in Ghana, that relative can visit any First Atlantic Bank branches in Accra, and you provide your bank, your travel details, your passport details to the third party, and also a correct email address. So once payment is made at the bank will email you a copy of your receipt, which you can use to board your flight. Also, any inquiries regarding the bank, complaints about the bank, this is the email, covidpay@firstatlanticbank.com.gh. Feel free to lodge your complaints regarding the issues for refund. In case you make double payment, you need refund. This is the email address that you can email the bank to channel all your complaints. So from the bank, your sample is taken. The passengers represent their unique barcodes for validation at the sample cubicles, where passengers will also, they will undertake, they will take their test samples will be taken in the booths. After taking the test, you proceed to the Port Health section. And at the Port Health area, passengers, your PCR test certificate that you arrived with from abroad will be verified by the health authorities, including your boarding pass and a yellow card vaccination card. And let me also stress this. Passengers are required to have a yellow fever vaccination card because they are entering an endemic zone. Ghana is one of them. So all passengers are required to have a yellow fever vaccination card upon arrival. And passengers who do not have yellow card vaccination, yellow fever vaccination card, and also without any proof to show that they've taken the vaccine, they will have to be vaccinated upon arrival. So for Ghanaians, the charge is 50 Ghana cedis, and for foreigners, it's $20 or 80 Ghana cedis for non-Ghanaians. So from Port Health, then you proceed to immigration, where you undergo all the immigration process, which they will check your passport, they'll verify your visa, you complete the immigration forms, and they'll take your bio details. Then from there, you proceed to the baggage claim, where you claim your luggage. Then you move to the next stage of checking your results. And also in the process of maybe claiming your luggage and whilst you're at the terminal, the same portal that you use to log your health declaration details, you can use that same application to check your result status. Once you log in, you see check result status. It will ask you of your passport details. Once you enter your passport number, the app will notify you whether if your test is ready or not. So passengers will present their passport and receipt to assess their test result at the next stage of Port Health after claiming your luggage. And passengers are also advised to expect some waiting period of approximately 30 minutes. So within a period of 30 minutes, your results to be in. But you can still check your results at the terminal using the portal and also using our free Wi-Fi at the terminal. So as I stated earlier, passengers who test positive will be clinically assessed by Ghana Health Service officials and transferred to an isolation center or a treatment center for a period of 7 days or more. Passengers who test negative will proceed to customs and they can join and proceed to their next destination. So once you get to customs will do their own checks, and passengers with unaccompanied luggage yet to be shipped by air or Ghana are required to complete a passenger unaccompanied baggage declaration form at customs. So immediately you finish all the customs formalities, then the passenger can proceed to his next destination. So let me quickly highlight some health protocols that we've instituted at our terminals, being it domestic or international. We've implemented no mask, no entry policy within the terminal, meaning that all passengers and airport staff within the airport are supposed to be wearing their mask. Also, we've also provided sanitizing stations at vantage points where passengers can use to sanitize their hands as they use the airport. And this slide highlights some of the other protocols that we've implemented. We've also fixed the social distancing stickers at the arrival and departure halls so that at least passengers will use it to observe social distancing. And this area where you see the tablets are the area that passengers can use to fill their health declaration form in case they were not able to do so before departing from their destination. So these are some of the few health protocols that we've implemented at KIA. And also let me jump into some exemptions. Per the guidelines implemented, there are some few exemptions. One is airline crew are exempted from the pre-departure and arrival COVID testing and should follow the airline policy for testing. So the airlines, they have their own policy for testing. So airline crew are exempted. And also passengers who under emergency circumstance that their flights are diverted to Kotoka International Airport are not required to undergo testing if they do not leave the airport or remain in isolation in their hotels. And also children under 5 years will not undergo the COVID testing upon arrival at the airport. But children between the ages of 5 to 12 are required to pay for the testing upon arrival. And for Ghanaians, they pay $50, and all other nationals pay $150. So let me quickly jump to the departure protocols. For departure, there isn't much restriction because the airport and government doesn't restrict departure when maybe passengers are leaving the country. But however, let me really highlight this important area. Passengers will be required to adhere to the COVID testing requirement for their destination countries. And it's important that passengers get enough information from their airlines and also have much information about the requirements and protocols at their destination airports or destination countries, because the airport doesn't restrict. But however, it is important that passengers get that information from their airlines, which is specific, country specific, and also the kind of requirements that pertains in their country of destination. And also Ghanaians resident in Ghana who depart Ghana and return within 1 week will not be allowed to present a COVID result from a country of departure. However, they will undergo mandatory COVID testing upon arrival. Also, only passengers and the persons with business in the terminal are allowed within our terminal to reduce congestion at our various terminals. And departing passengers will also undergo temperature screening at the entrance of the terminal. And also, we also encourage passengers to use the online self-check-in kiosk provided at the terminal to reduce congestion at the check-in areas. And also, passengers are also advised to arrive at the airport 4 hours before schedule, so that at least they can undergo all these protocols to enjoy their journey to their destinations. Passengers are required to always wear masks at the terminal and also use the sanitizing stations provided at vantage points within the terminal to sanitize their hands. So, in summary, for the departure journey, you drop off, you have a trolley area, you undergo temperature screening at Port Health. Within the terminal, you have self-service kiosks that you can use to do your check-in. You undergo a profiling check before the check-in process. Immediately you finish your check-in, you proceed to I-validate, then to immigration. Immediately you finish your immigration process, you move to the security screening, then you proceed to the boarding gate to wait for your flight. Same at the departure hall, so we've implemented the same health protocols. No masks, no entry. Passengers will undergo thermal screening. That is, every passenger who enters the terminal will be screened. Will undergo temperature screening. Also at the check-in halls, we've installed protective screens at all passenger interaction points, check-in counters, customer service desk, and also the writing desk areas that passengers use to fill their form. And also all check-in counters too are protected with these shields. We have floor markings on the terminal to aid social distancing protocols and all queuing areas at the terminal. And also, we've also implemented seating area separation at the various seats that we've provided for our passengers. Last on my presentation is on the communication channels. At the airport, we have a lot of communication channels that our customers can use to reach us. We have a 24-hour call center, and you can reach us anytime to make inquiries, to lodge and complain, so that at least we can handle your issues efficiently. The number is 0302550612. We're also on Facebook. Our website is www.gscl.com.gh. We are on Instagram, we are on Twitter, and we are on LinkedIn. And also, aside that, we have customer service points within the terminal that passengers can go to lodge their complaints. And these are the few communication channels that we've implemented at our terminal. So, thank you very much. This brings to an end to my Maxwell. Maxwell J. Chumesi is a focal lead person for Panabios. He will just take us through 10 minutes presentation on the new measures that has been implemented. So at this point, Kwesi, I'll hand over to Maxwell.
Okay, and thank you very much, Eric, for the opportunity, and a good evening to everybody who is listening. As I was introduced, my name is Maxwell, and I'm speaking on behalf of the Panabios Consortium, and I will be taking us through a very few steps that are required by a traveler to be able to enter the country firstly and also to exit the country. So a brief background about the technologies that are being implemented. We have, of course, the work of the Port Health can never be effective without the right tools and technologies implemented to help them do their work. The wake of the pandemic, we have realized that a number of events that saw the use of fake health documents to travel, which was creating a lot of problems. And there was therefore a need for the right technologies to prevent the instances where fake travel health documents will be used. So we have the Panabios tool, which is being implemented to ensure that all travel health, including your vaccination reports and the PCR test, can be verified by the Port Health. And to travel into the country, you are required to also present a PCR test and also what we call a travel code, which is generated by a traveler and is definitely a proof that the traveler has actually met all the health related requirements to be able to enter into the country. So I'll take us through the brief processes of generating a travel code or even obtaining a verifiable lab result from an accredited lab. So users are advised to visit the trustedtravel.panabios.org to first of all sign up for an account. So once they have their account, they can proceed quickly to log into the account to begin the process. At this stage, I'm assuming that the traveler has already visited a lab, which in this case, we have two kinds of labs that you can visit. We have the trusted lab, which basically is part of the trusted lab network around the world. And you can have other labs which are yet to be onboarded into the trusted lab networks. So in those two scenarios, we find that one particular traveler will have a PCR test that has been issued by a trusted travel lab and one that has not been issued by a lab that is yet to be onboarded. In both cases, the traveler is still able to generate what we call a travel code. And I'll explain that into much detail. So once you have your login credentials, you are able to sign in onto a dashboard. And this is how your dashboard will look like. On the dashboard, you have access to present your document for validation. So you can see that we have two main cells in there. A test uploaded by a trusted lab, and then a test uploaded by a traveler. So if you were privileged to have had a trusted lab within your community, your lab result will be automatically uploaded into your account from the lab. And you are able to use that lab result to complete a process to generate your travel code. In other instances, if you didn't have a trusted lab in your community, then you have the privilege to also use the platform to upload the lab result that was issued to you by the lab you visited. So to begin a check-in process, which is the process of generating a travel code, which is also a code that will be requested for by the Port Health at the point of entry, you have to proceed to the check-in button. So once you go to that particular button, the very next action that will happen is that you will be required to enter your travel route. And let's proceed to the next slide, please. Okay, so what you see here is the information request sheet that is requesting you to indicate your route. So you can indicate your departure country and then your destination country. Once that is done, you proceed to the next stage to choose a lab test, which could be either uploaded by the lab as I have explained, or you can also choose the option to upload the lab test by yourself. I think the next slide, please. Okay, so the option that requires you to provide a lab test, as I've explained, you can choose a lab test from your own account, which was uploaded by the lab, or you can also upload your own copy. And this is where there is a clear indication of your obedience to supply a PCR test, which will be used as the main information to help you generate a travel code that the portal can verify. And next stage, please. Okay, so the very next thing you do is to also enter your travel health information, which will include the name of the airline that you are using, your seat numbers, your flight number information, and then your passport numbers. Not to worry, these fields are not mandatory. If you don't have these information before your travel, that is fine. But the ideal situation is that you will have to provide your passport number, because that is you should always have a passport before you even think about traveling. So your passport number must be provided. Next stage, please. And the final step is the generation of your travel code. So to really explain what a travel code is, the code is actually presented here in a 2D scannable form and also in an alphanumeric form. You can either download the scannable code onto your phone and make it ready for scanning at the airport, or you can write the alphanumeric code on any portion of a document that you can retrieve. So at the point of station or the port of booth, scanning of this particular travel code will display your lab results and other health documents that are required. So without the travel code, the Port Health may not, you may not be allowed to enter the country, because that will be the way the Port Health can verify the authenticity of your lab results. There's a question that can possibly come up. How do we verify a lab result that was uploaded by the lab, a different lab that is not in the trusted network? Do we know these labs? No, we may not. But the algorithm that has been built into the system has a forensic ability to be able to detect and advise the hotel on the authenticity of the lab result. Not to forget a mention of a partnership with the UNDP and access to a large database of lab. We have the right tools and the capacity to detect any anomaly. And once you're found out for uploading wrong documents, it may affect your entire travel experience. So we always advise the traveler to adhere to uploading the right travel of documents. And next slide, please. So before your travel, you would also want to know more about the prevailing travel restrictions that apply in various countries. And on the on the website of the African Union, African CDC, you have the privilege to run a query or a search for these restrictions based on the destination country that you are going. So in effect, the solution has been implemented for all African countries, and irrespective of the final destination that you're going to, you will get information on the prevailing updated travel restrictions that apply to these places. Next slide, please. Okay, so to mention it, the various apps and the partners that are behind the platform, you have the Biomass, you have Delphix, and all these major partners who are ensuring that the platform is effective and robust to ensure that safe hubs and safe bubbles are always in place to protect the people in Africa and beyond. So I think that will be the end of, and the same processes apply when you are leaving the country. You'd have to visit a trusted lab in Ghana to obtain a lab result that has a verifiable code. At the point of exit, the portal will also scan that particular lab code and also scan your travel code. And this will be your permit to travel and to leave the borders. So I think that will be the end of my presentation. Thank you very much.
Thank you very much, Maxwell. Okay, so this brings us to the end of our presentation. And that's my contact, my email address, in case anyone will require further inquiries about the airport protocols. Kindly feel free to email me, WhatsApp me, or SMS. Thank you very much, Mr. Kwesi, for the opportunity. I'll hand over the floor to you. Thank you.
Thank you very much. Thank you so much, Eric and Maxwell. Thank you, Eric, for the time. We will have a barrage of questions to come. I certainly have a lot. And I'm sure audience to have put some messages on the chat, which we'll come back to. For Dr. Zabaru and Ifa, this might be a new thing to you, but I'm sure we are all learning about Ghana too. So please, thank you for bearing with us and going through this presentation. I know today was more of question and answer session. We will take a second break for everybody to grab a drink as we have 1 hour Q&A to go through. Feel free to get a drink while we take a quick break and we'll return.
Enjoy some fabulous rewards. Get a cool £10 reward when you receive £100 or more from the UK. Tell your friends and family in the UK to send money to your mobile money wallet or bank account using Express Pay and get an extra £10. Terms and conditions apply.
Welcome back again to you all, my audience for this evening and panelists for this evening. Thank you very much for being with us. And this is the time we'll be going through all your Q&As about vaccines, about anything you have. We will do a mixture of the questions. So Mr. Prepra and his team will be answering any questions about travel. Dr. Zabaru, Mr. Prempe, forgive me. Mr. Prempe and Maxwell will answer questions about travel, and Dr. Zabaru and Efamoti will take care of questions around vaccines or any clinical issues that our audience may have. I will obviously have to highlight that this event is put together with the support of the Ghana Nurses Association UK, the Western Region Nurses Association UK, the Nightingale Nurses Association UK, and of course Ghana Union UK, and supported by Ghana High Commission, Express Pay Money Transfer, and Omega Live TV. We are here to educate, to inform, and leave you to make the right choices for yourself. And so therefore, any information you take here is for your own guidance and advice. You are not here being compelled to do anything otherwise. I will go straight to some questions for this evening. And my first question that I received a series of other questions. And it will be about COVID and vaccine. So any of the two panelists can articulate their views on this. If you know, anyone can take a turn and answer it. Can the vaccine modify my DNA? We have some young ones who are still concerned that there are concerns about vaccines changing your DNA and turning you into something else.
I will answer that one. No, it doesn't alter your DNA at all. The way the vaccine works, it works in your body cells, but it doesn't go into your nucleus that's in the cell, and that's where your DNA exists. So all the function of the vaccine, how it generates immunity, is outside the nucleus, so it doesn't alter your DNA.
Okay, thank you. Dr. Zabaru, you want to add anything to it, or you're fine with it? Or...
That's exactly right. It's the Pfizer vaccine is an mRNA vaccine. That's completely different to DNA. And as the previous speaker just said, it doesn't enter the nucleus, so it's not going to affect your DNA.
Okay, thank you very much. And so, would the vaccine protect me against any new strains if I were to take it? Anybody considering to take it now, how can we guarantee or assure them that this vaccine is going to protect them against Kent variant, South African variant, or Indian Delta, as they call it now, and any other thing that we are yet to... I was listening to the news today, and there was another one that they are now tracking, which has recorded 5 cases or so far. How can we assure this audience that these vaccines can protect them?
Shall I take that one again? So far, we've had very good protection against the variants that have been generated. We can't assure the public that in future variants that emerge, the vaccines will work against them, but the evidence so far shows that they are effective against the new variants. There is a term that's called immune escape. And when the vaccine, so it depends on how often the vaccine infects people, the virus infects people. So the more it infects people, the more chances of the variants to mutate and then become dangerous. So that's why it's really important that people get vaccinated, because when they're vaccinated, there's less chance for them to get infected, incubate the virus, and then for the virus to mutate and then come out and infect others. But so far, so good. You know, the vaccines are working. They are effective against the variants that have emerged. And even the South African variant that they said the AZ vaccine didn't protect people as much against. If you were in South Africa and you were vaccinated, it would have protected you from getting hospitalized. You would have had a mild form of the disease.
Thank you. The next question is about travel. And so, Mr. Prempe, if you can unmute yourself for us, please.
All right.
Somebody wants to know, why is the variation of cost to the testing at the airport, Ghanaians $50, non-Ghanaians $150? And what does the word non-Ghanaian mean to somebody who has UK, German, or any other dual nationality passport, including Ghana passport?
Okay, thank you, Kwesi. The issue of the $50 and the $150 is really something that I cannot comment.
Right.
But for the education on the definition of non-Ghanaians. Non-Ghanaians means passengers who are not using Ghana passports. But if you're a dual citizen, you're British and you have the British passport and you have a valid Ghana passport that you are traveling with, then obviously you're a Ghanaian, so you pay the $50.
Okay,
but
so
if you're coming with a British passport alone, if let's say you are a Ghanaian, but maybe in the course of the journey, you forgot to maybe use a Ghana passport, but you use your British passport with a Ghana visa in it, then obviously you came in as a British citizen, so you pay the $150.
So if I'm right, if I heard you right, if somebody arrives and has a Ghana passport has a British passport with a visa in it, even if they have Ghana passport, they forgot to use that one and they just traveled and checked in with their UK passport. Even if they have the Ghana one with them, they will still have to be treated as a foreign national. Is that what it is?
No, once you came with it and it's a valid Ghana passport, then you pay the $50. I'm saying in case you left it in UK and you came with a British passport, then obviously you came in as a British and you paid the $150.
I see. Okay. I'm sure we are all clear with that. I'll go back to a vaccine question about fertility. Can a woman who is trying to conceive have the vaccine? And does the COVID-19 vaccine affect fertility in between the time you take and the time you want to become a mother or father? In terms of fertility-wise. So, can a woman who is preparing to become a mom take the vaccine, or can they have it in the course of obviously conception?
Yeah, so there's lots of questions about pregnancy and also fertility, but the latest advice from the Joint Committee of Vaccines and Immunizations is that COVID vaccines should be offered to all pregnant women at the same time as the rest of the population. So that's in line with their age group rollout. That has previously been updated because previously, before April, it was previously that women with high risk of exposure to COVID or with medical conditions that put them at risk should be the ones that have the vaccine. But now all pregnant women should be offered the vaccine. In terms of fertility, there is no evidence that it will affect women's fertility. So it is safe for women to have the vaccine if they are considering to become pregnant. And the British Fertility Society have come out and stated that as well.
Does it have any impact, or is there any assurance that it has no impact on sperm count? If any young person considering taking the vaccine and they are worried about also becoming a father, does this vaccine or whatever is in circulation, how do we assure these people that they will still become fathers irrespective of what? I know you've talked about pregnancy and motherhood.
When we're talking about fertility, we're talking about male and female fertility, really. Yeah. So again, there's no theoretical risk. There is no reason why it would affect any male or female's chance of becoming a mother or father.
Okay. Thank you so much. Somebody says, I'm just 18. Why should I get the vaccine now when back in February, March last year, we were told that the virus has no impact on young people? Why? What is the sudden change, and what is the evidence behind the change?
Okay, I'll take that one. So what was said then was when you catch COVID at for the younger population, the chances of you to get it as severe as an older person was less. So this person who's asking the question, I'm sure would have known many people in that age group who have had COVID. And the problem is we don't know if you have an underlying health condition and you're in that age group, you would have been offered the vaccine. And also, unfortunately, some young people who don't have any underlying health conditions have caught COVID and have had severe outcomes, however, less frequently than the older groups. Another issue why you might want to get vaccinated as a younger person is you could catch COVID and it could be mild and you would not know about it, and you could carry it and transmit it to someone who is vulnerable, and they will become more severely ill. And the last thing is also you could catch it, it could be mild, but then you could also go on to get what we call long COVID and have symptoms that would last a very long time and affect your life and your daily the things you do daily. So it is it's good to be vaccinated at all ages, and now trials have come out to say that it's safe in children 12 and above. So we will be looking at some point in the future maybe to vaccinate them too. Dr. Zubaru, would you add anything to that?
Yeah, I mean, I think the caller, the question, they're right in a way that age and pre-existing illness is definitely the biggest risk factor for becoming unwell with COVID. But just because they're young doesn't mean they are at no risk of COVID. They are at low risk, but not no risk. And then, the biggest issue I'm seeing at the moment is younger people with long COVID. So long COVID is where they have symptoms of breathlessness, debilitating fatigue, palpitations. And these are people that have had these symptoms for more than 12 weeks, can't go to work. It's really affecting their day-to-day living. So the vaccine protects you against getting COVID and also will help with reducing the chance that you'll get long COVID as well. So that's really why it's really important for young people to have the vaccine.
Thank you very much. I'll be going to Mr. Eric, please. Eric, there's a question about how much does it cost in laboratories, general view of cost that you have to pay if you want to get a test back to UK before you depart from Ghana?
Okay. It varies across the various labs, but I think I can give a range. Maybe within the range of 400 to 600 Ghana, you can have your PCR test.
You can have, okay. Is there any?
Some labs can provide a service within 24 hours. Some too can also provide it 48 hours. But within a range of 400 to 600 Ghana cedis, you should be able to have a COVID test.
Okay, I wasn't going to have an opinion, but I'll add to it that I have just recently come back and I did a couple of tests. There was one for 500 Ghana. If you want it between 6 to 12 hours, there's one for 250 Ghana cedis if you want it within 24 hours. And there are some places charging 350 Ghana cedis if you want it 24 hours. So it just falls within what you just said. That's why I thought I should at least add to it. Thank you very much. And I'll ask you another question again before I go back to the vaccine. Okay. So there any requirement for people transiting through other countries? Are there different
Yes,
requirements?
there is.
Because if somebody's coming from UK going through Amsterdam or
UK.
any other
Okay. Let me
some of the
explain that.
requirements that
Okay, for instance, if let's say you are connecting from Kotoka International Airport to, let's say, Lagos, and you did per the ticket that you use, the facilitation was booked from, let's say, Heathrow to Lagos direct. It means you are not entering into Accra, even though you are going to transit through Accra. You are not terminating at Accra. So that one, you are not entering into Ghana. You just being within the terminal and you proceed to your next destination. That one, you will not pay for the COVID test. But if your ticket was scheduled in a way that, okay, landing to Accra, you terminate, pick your luggage, and you have to do check-in again to your next destination. Then you've entered Ghana. Then you have to pay for the COVID test. Because per the guidelines, anyone who enters into the shores of Ghana should undergo the mandatory COVID-19 test upon arrival. But if you are connecting direct from the airport direct to your next destination, then you do not pay for the COVID test.
Okay, thank you very much.
To the health and the safety of all Americans, I'm here to discuss our strategy to prevent and protect the American people from a possible outbreak. I appreciate Dr. Rich Carmona, the U.S. Surgeon General, Dr. Tony Fauci, Director of the National Institute of Allergy and Infectious Diseases. Scientists and doctors cannot tell us where or when the next pandemic will strike or how severe it'll be, but most agree at some point we are likely to face another pandemic. The virus has developed some characteristics needed to cause a pandemic. It has demonstrated the ability to infect human beings, and it has produced a fatal illness in humans. If the virus were to develop the capacity for sustained human-to-human transmission, it could spread quickly across the globe. Our country has been given fair warning of this danger to our homeland and time to prepare. Our strategy is designed to meet three critical goals. First, we must detect outbreaks that occur anywhere in the world. Second, we must protect the American people by stockpiling vaccines and antiviral drugs and improve our ability to rapidly produce new vaccines against a pandemic strain. And third, we must be ready to respond at the federal, state, and local levels in the event that a pandemic reaches our shores. And unlike storms or floods, which strike in an instant and then recede, a pandemic can continue spreading destruction in repeated waves that can last for a year or more. To respond to a pandemic, we need medical personnel and adequate supplies of equipment. In a pandemic, everything from syringes to hospital beds, respirators, masks, and protective equipment would be in short supply. To respond to a pandemic, the American people need to have information to protect themselves and others. In a pandemic, an infection carried by one person can be transmitted to many other people, and so every American must take personal responsibility for stopping the spread of the virus. By making critical investments today, we'll strengthen our ability to safeguard the American people. In the awful event of a devastating global pandemic, and at the same time, we'll bring our nation's public health and medical infrastructure more squarely in the 21st century. Leaders at every level of government have a responsibility to confront dangers before they appear and engage the American people on the best course of action. There is no pandemic flu in our country or in the world at this time. But if we wait for a pandemic to appear, it will be too late to prepare. And one day, many lives could be needlessly lost because we failed to act today.
Okay, I know this might be a bit out of your terrain, and you should feel free to say you won't comment. But how You see, when we are encouraging young generation who are media savvy, listening to these sort of statements, everybody knows when George Bush left office. So for somebody in the free world in the 2006 and all that, preempting a pandemic, and then all of a sudden we are here today. How do we convince people that who have a different view? We are not here for anti-vax, but we need to be able to let people know: is this a coincidence, or is this statement something that just doesn't we don't have to worry about? Because I have a lot of questions about this, and we thought we should find out what you think. Some people think pandemic was a preconceived issue. What do you say to this? Doctors and scientists, please make a view if you can.
I think it's really difficult, isn't it? I mean, a pandemic, hopefully, is a once in a lifetime event. But I know the government do exercises where they do mass exercises preparing for pandemics. So it's difficult to say whether or not this was pre-prepared, but for my feeling, it's not a conspiracy theory. It's nothing to do with Bill Gates. It's not a pandemic. It is just a coincidence that this has happened.
Would you agree that this is one of the reasons why there are so much hesitancies in the system, especially for younger ones who either have not experienced much of life situations and don't trust the system? And we just thought we should give this as a background so that you can speak to it and maybe use your scientific background to convince that this is something maybe coincidence, as you rightly said, Dr. said.
In my opinion, the human race has been experiencing pandemics even since the Bible times. It's there, and every 100 years we get a pandemic. So it wasn't if, it was when. So and apart from that, there have been other diseases that started, like Ebola, for instance, but that was contained and it wasn't as infectious as the COVID as well at the time. Although there was a lot of media presence there, but it wasn't airborne like COVID. So it was bound to happen, and it has happened. And I just feel, as humans, we all need to come together to try and fight it. And also, it's the more we let it through our societies, the more we're going to get more variants, which could come out and be more innocuous and harm us even more. And apart from that, also, I feel the pandemic has highlighted our poor metabolic health. So that's something that we also need to think about. How are we living? What are the lifestyles that we are engaging in? Are they healthy lifestyles? Because you can see that it's picking up, it's people who have poor health who are suffering from it. And a lot of our health stems from poor lifestyles, things that we can change to make ourselves healthy. So these are all things that we need to think about in this modern time and try and improve our health, because some people catch the virus if they're very healthy, it doesn't affect them. But some people who may have blood pressure, diabetes, obesity, they have worse outcomes. And these are all things that we can work on to help improve our health, so that if the next pandemic comes in our lifetime, we might be better prepared for it from our own immunity as well. So these are things that I think about, and I think others should be thinking about also.
Okay, another question, before we go for a quick break, so that you can have a break. Why are people under 40 being offered an alternative vaccine to AstraZeneca ones? There is this perception. I have no idea I have no means to verify it, but perhaps you may have an idea that there are some areas where people are being offered under 40s, which is a target group now, and that is the reason why some of these forums are being done, to get them to believe in the system and what is going on and take it, that they are being given a different vaccine towards Oxford AstraZeneca here. Do you have any thought on it or any view on it?
Yeah, I mean, so the vaccines that are licensed in the UK are the Pfizer, the AstraZeneca, and the Moderna. A couple of months ago, there were some concerns about a rare blood clot with the AstraZeneca vaccine. We're not sure whether the vaccine causes those blood clots or whether or not it is associated with those blood clots. So when you vaccinate mass populations, you will get events that occur, and it doesn't necessarily mean that the vaccine has caused those blood clots. Certainly for elderly people or people over the age of 40, that risk benefit ratio, the risk of having a clot is greater than the actual benefit of having the vaccine, certainly for the AstraZeneca. So the decision was made that under 40s should be offered an alternative vaccine. We're lucky we have lots of Pfizer, we have lots of Moderna, and for that reason, we can offer under 40s an alternative vaccine. So that's the reason.
Okay, thank you. We'll take a quick break. If you can grab a drink, and then we will return.
Enjoy some fabulous rewards. Get a cool £10 reward when you receive £100 or more from the UK. Tell your friends and family in the UK to send money to your mobile money wallet or bank account using Express Pay and get an extra £10. Terms and conditions apply.
Okay, welcome back. Trying to. Oh no, my system is frozen. Welcome back to the show. I'm having my system frozen here, but I'm sure if you can hear me, we'll still carry on. There's a question for our travel man, Mr. Eric Prempe.
Okay.
It's to do with the fact that people will test here and then they will be arriving in Ghana in less than 24 or 48 hours and be required to test again. Why is that? I mean, I know it's a government policy, but is any idea from a customer? I mean, do you have any view on it or any position on that? Or have you actually come across people who have become frustrated because of that sort of situation?
Yeah, we've encountered people who really have raised concerns about it. But from day one, that has been the protocol by the states as part of reopening when the airport was shut down for like 4 or 5 months. One of the key guidelines towards reopening was to ensure that whoever enters the shores of Ghana should undergo that test, irrespective of you coming up with a PCR test. And I think there've been a lot of sensitization, there've been a lot of concerns, but there's still that requirement that government and the regulatory bodies and the Ministry of Health has made it clear that any person entering into the shores of Ghana should undergo the mandatory COVID-19 test, whether if you've been vaccinated, because the last updated version that we had is as at 9th of February. And that protocol still stands. Any person entering into the shores of Ghana is mandated to undergo this test.
Okay, I'll go back straight to you again, Mr. Prempe. There's a question about how strict are the immigration. I know you're not an immigration person, but somebody wants to know if you can share a view. How strict are they with the yellow fever vaccination at the checkpoint? Because someone seemed to have appeared to think that they don't even ask at all.
Okay, the yellow card vaccination card is handled by Port Health Services, not immigration.
Right.
So as part of the protocol set up at the arrival, first Port Health point, the checks that you have is your card, yellow fever vaccination card. verification of your PCR together with your boarding pass and your passport. So these are checked. And that is the first port health point, which every passenger will undergo that check.
Okay, now come back to you again. You said earlier that the waiting time between the time you arrive to get your test is 30 minutes. Somebody wants to know what is the overall waiting time up to the time you actually depart? Because there are times where some people have actually queued more than 30 minutes at when you get to the health post.
Okay, the 30 minutes is after taking the sample. You are expected to get the result within 30 minutes, not the overall arrival process. That is when you disembark and you leave the terminal. But once the sample is taken from the health cubicle, within 30 minutes, you are expected to get results.
I see. Thank you very much. I'll go back to my Dr. Zabaru and Ifa on this one. What should I do if what should I do if I already had one dose of the AstraZeneca jab and my GP says I should wait until they get some in because wherever I went was not having at the time of my second one. What should I do? For instance, somebody has taken it. It's time to take the second one. The GP said that's some type of, I guess you have to take the same thing again, isn't it? And it's not available. What can that person do?
So so one thing that they could do is they could find out where within their borough people are running the AstraZeneca vaccines and call them and book the second dose there. Otherwise, they would just have to wait because so far in the UK, we're not mixing vaccines. I know other places, other countries are at the moment, but we're not doing that so far. So they just have to wait for their second AZ dose.
Okay. And another question.
The national booking helpline as well is if they ring 119, 119 should be able to help them and be able to source a centre that has AstraZeneca for them.
I see. Okay, thank you. Is anyone liable for the safety of the vaccines in circulation?
So when it comes to the safety of the vaccines, if you are harmed due to the way the manufacturer produced the vaccine, there's a government scheme that will compensate you on that. No, actually, sorry, I'll say that again. If you get any harms from the vaccine, which is not due to the manufacturer's process, there's a government scheme that will compensate you. However, if it's due to the way the vaccine was put together by the manufacturers, then they are to blame. So if you get harm from the vaccine, like, I don't know, your nose dropped off after you had the vaccine, yes, the government will compensate you. But if maybe the vaccine was contaminated during the manufacturer's process and you got harm from that, then the manufacturers will compensate you. So that's the protection.
Okay. Thank you very much. I will ask another question. Can the vaccine cause irreversible side effects? Do we have any sort of knowledge of evidence-based facts that there could be possibility of some irreversible side effects from any of the vaccines that we are currently taking?
I think when you have any sort of vaccine, you expect short-term side effects. So the short-term side effects are often a sore arm, a headache, muscle aches, fever, chills, and that's just your body mounting an immune response, really. So that's actually probably a good thing. In terms of long-term side effects, the question that you're asking, the vaccine has been trialed on hundreds of thousands, millions of people worldwide, and there aren't any. Well, there are, people can report any side effects on the yellow card scheme. There aren't any actual trends that says that this is a long-term effect, that the vaccine is not safe. So we knew about this rare side effect in terms of the central venous thrombosis, that rare type of blood clot that I mentioned about a few minutes ago. But again, the yellow card system is there for reporting any type of side effect to any sort of vaccine. And what the manufacturers are doing are marrying up those side effects with the vaccine. And if there is any doubt about a vaccine, that vaccine will be pulled or will be looked at, really. So the vaccine is safe. We can reassure people that the vaccine is safe.
Thank you, Doctor. There's another question about, could the vaccine give me COVID-19? There is a question about the fact that the vaccine could potentially actually give you the virus itself.
Okay, I'll answer that question. So the vaccines that we're using here in the UK do not contain the COVID-19 virus. They only contain like a protein that codes for the spike protein on the virus. And that's not enough to infect you and make you sick. It just can't happen. So when you do get the vaccine, you will get an immune response, which will be similar to a viral infection, but you are not being. That's just your immune system building up antibodies, and it goes to show with all other vaccines, you get a similar immune response, and that might give you a fever, chills, headache, a muscle weakness for maybe up to 24 to 48 hours, but that doesn't mean that you're infected with the vaccine. With the virus, what could happen is at the time you get vaccinated, if you were exposed to the COVID virus, you could catch COVID. So it might happen at the same time. And then when you go and get tested because you're not feeling well and they say you have COVID, you might think, oh, it's because I had the vaccine, but that can't happen. That would never happen. It would be because you were exposed to COVID at the time of the vaccination. So if you do get vaccinated and then you do seem to develop symptoms of COVID, just go and get tested and then isolate as per NHS advises you.
Thank you very much. Mr. Prempe, I'm coming back to you again. There's a question about what help are available for those who are less literate and could not have possibly gone through the the expected forms that you require them to fill before they arrive. And if for any reason the airline has allowed them on without even noticing that they don't have it, what do you do for those people when they arrive?
Okay, thank you very much. We've put some measures in place for them. Obviously, we know that maybe some passengers will find it difficult to even fill the form before they get to Ghana. So upon arrival at Kotoka International Airport, we provided tablets that the passengers can use, and we have customer service officers around to assist these passengers to complete the forms. Any flight that touches down, we have customer service officers around the tablet area to assist passengers who cannot use who are not IT savvy to even use the tablets to fill the form, which they will assist them to do so.
Thank you so much. There's I'm not sure whether this is a question or comment, but there's someone saying to me here that I arrived at Kotoka. I spent almost 1 hour at the counter where the medical people are, and while we are waiting and hundreds of us waiting, all I could see was people being taken through the back door as VIPs and bypassing the queue. What sort of customer service is this, and what would you say to that?
Oh, okay. I mean, that's quite unfortunate. Basically, when the passengers are done picking their luggage and waiting for the reports, there are times that we experience intermittent delays as part of the transfer of data from the lab to the systems at the port health area. When the results do tripping, the names of the passengers are mentioned. because everything is done electronically. It's not manual. The transfer of data from the lab to the resource center is done electronically. So when the reports do come, the passengers are notified, but not that somebody can just pick a passenger and bypass the rest whilst the results are not ready. So I must say it might be something quite unfortunate, but as part of the ideal procedure, passengers within 30 minutes, they should receive it. But sometimes there are intermittent breaks in the transfer of data, which increase the 30 minutes. But we've put in a lot of efforts in terms of the infrastructure to ensure that the passengers receive their results within these 30 minutes.
Thank you. I will stay with you again on this. We have different testing centers in Accra, especially, and there is this person who is sending me a message here that he tested twice on the same day. One test was positive, one test was negative, and he managed to return here with a positive one. Which of the two tests would he believe? And how do we ensure that these things don't happen?
That is quite unfortunate, but I think there's some science behind it. If doctor can explain, it happens. I mean, someone can board from London, negative, arrives, and the person tests positive. I think those in the medical field can really explain.
You can share your thought, Dr. Zabaro and Efa. Was there a scenario where someone can be tested twice on the same day and have two different results?
Yeah, I suppose it could happen that the tests are not 100% accurate. So you can have false positives where someone tests positive, but they don't have COVID. And conversely, you can have false negatives where someone tests negative and they are actually carrying the disease. So yes, it can happen. Yeah.
Okay. So Eric, thank you very much on that one. I'll be going back to the COVID questions again. Somebody wants to know, how do we know we can trust the vaccine? What assurance you can give us, the experts?
Well, I would like to answer that actually, because I feel the vaccine can be trusted, because right now, when we go to the hospitals, our vulnerable citizens who are vaccinated first are no longer catching COVID. It's rather the younger age groups who haven't been vaccinated who are being admitted, and those who didn't get vaccinated. So when it comes to trusting if it's efficacious, I would say 100%. And I am so happy that we've found something to prevent the unnecessary, terrible deaths that we all know have happened, especially in our communities. So when it comes to efficacy, I trust it 100%.
Okay.
When it comes to side effects, usually with most vaccines all over the world, the side effects are within the first few weeks. And as we have expanded the vaccination program, we have picked up the very, very rare side effects, of which our doctors are now, they're very skilled and they know how to manage them for patients. So if you are unfortunate and you get an extremely rare side effect and you go to hospital now, you will be managed appropriately. So the early days of when the clots started happening and we didn't know about it, they didn't know how to manage them as well as they do now. So I have a lot of confidence in the virus, in the vaccine, and I have recommended it to my whole family, and they've all been vaccinated, and so have I.
Thank you very much. Thank you. The next question is, how long should I wait? I'm a regular person that normally go for flu vaccine. How long should I wait in between taking my flu vaccine and consideration to take my COVID vaccine?
It's 7 days.
7 days.
Yes, 7 days.
Right. So you can take your flu vaccine, 7 days later, go for your COVID.
Yes, that's right.
Oh, okay. Right. Okay. That's good. Right. Okay. Are there any studies into COVID-19 vaccine and pregnant women to show benefit to those in that category? And at what stage within pregnancy should I take the vaccine?
So there aren't any specific trials with regards to pregnancy, but what we do know is in the original trials, lots of women became pregnant while they were in the trials. So we have that data. We also have the data from America, where tens and thousands of women have been vaccinated, pregnant women have been vaccinated. So we have assurances from that. In terms of when to get the vaccine when you're pregnant, that you can have it at any time during the pregnancy. There's a lot of people that actually think that it's probably better to have it later on. So the first 12 weeks of pregnancy, where the fetus is growing rapidly, a lot of people would like to try and avoid those 12 weeks. So most people will have it after 12 weeks, but you can have it at any time during pregnancy.
Okay, there's a question about most people believe that those undertaking the vaccinations get paid. How much do they get paid for pursuing to vaccinate as many as possible, especially those who are on the vaccination camps and centers, including GPs?
I'll answer that actually. So, because I work in primary care and we commission services from GPs, GPs get paid for all immunizations. So, and it would be fair not to compensate them for vaccinating people. So, and the price varies across, across the different immunizations. So for childhood immunization, for flu immunization, GPs get paid per patient. So it's no different from what we would normally do, what NHS England normally does. So everybody who participates and vaccinates people, they get paid for their time. They're not volunteering. Although the vaccination program has a lot of volunteers to support it, and without them, we wouldn't be able to do what we're doing now. It's the biggest vaccination program that NHS England has carried out, and it has been extremely successful.
Okay, thank you very much. Thank you. Somebody want to know how many volunteers of Black background undertook the process of getting these vaccines in place. How many volunteers roughly you have in mind that took part in the the testing process? Or
in the clinical trials?
Clinical trials, yes.
Yeah, so for both Pfizer and AZ, there was about 10% of Black people in the studies.
Okay.
And that is overrepresented, because in most clinical trials you do not get 10 to 11% of Black people in clinical trials. So that is really reassuring as well.
Thank you very much. Does somebody want to know, is there any specific recommendation for a type of vaccine for pregnant people or breastfeeding mothers?
So in terms of pregnant women, we're tending to recommend the Pfizer and the Moderna vaccines, because they have the most evidence for them. In terms of breastfeeding ladies, again, most breastfeeding women will probably be under 40. There are some mums that are above 40, but under 40s, it's recommended not to have the AZ vaccine. So it would be the Pfizer and the Moderna vaccines again.
Right. Thank you very much. And then I will go back to, I will stay with you for now, and I will go back to Eric later. So any stage of the pregnancy, you will be recommending the Pfizer or the Moderna. Is there any stage where you consider AstraZeneca if those two are not available? Or is it just a strict recommendation that those pregnancy period must go for that vaccine because of its efficacy?
I think it's a conversation, isn't it, between a healthcare professional and a pregnant lady. the evidence is that they should probably have the Pfizer and the Moderna. But if those two were not available, then you'd have to have a conversation discussing the risks of AstraZeneca versus the benefits of AstraZeneca versus the risks of catching COVID while you're pregnant. So it would be a risk-benefit conversation. But thankfully, supply at the moment is not an issue, and there is enough Pfizer, there is enough there is enough Moderna as well.
Okay. The next question will be for Mr. Eric, but it's in two parts, which I believe the clinicians can help to answer at some point. Mr. Eric, people want to know those traveling from to Ghana. Do you have any traffic light system as we have in UK? And if not, does that mean anybody from any country, whether they are epidemic savvy or wherever, can just walk into Ghana and not have much other than a test? And on the other part, they want to also know what is the difference between antigen test and a PCR test. So it's in two parts. If Eric wants to attend to the first part, which is, do we have any sort of system to say, look, like in UK, if you come from a red country, you end up in the hotel straight away, and you don't even get to come home. If you come from amber or wherever green, then you are happy to go. Is there any system like that in Ghana?
For us, that is why, as part of the requirements, there is this double testing. That fine, you need to come with PCR 72 hours, and also you need to test once you get to the airport. So for us, these are the measures put in place. And should you be positive upon arrival, you will be taken to a unit for clinical assessment. Whether you go to a treatment center or you'll be isolated for 7 days or more. So for us, that is the measures implemented within the country.
Okay, thank you. And on the other side, can any of the clinicians, doctors, and give us any view you have when it comes to the difference between PCR and antigen test?
Yeah, sure. So, I mean, PCR tests are seen as the gold standard. They're slightly more purifying cases of coronavirus because they require lab analysis, really. And what they do is they detect the genetic material in a sample from the nose and the throat. And that's why it's more expensive when we're talking about travel. It's a more expensive test. Lateral flow tests are antigen tests, and rather than detecting the genetic material, they detect proteins that are specific to the coronavirus. With a lateral flow test, you probably be all familiar. You'll get the result. It's like a pregnancy test, and you'll get the result within 30 minutes, whereas a PCR test will take 24 to 48 hours.
All right. Thank you so much. And Eric, if I may come back to you, on arrival at Kotoka, which one is being done there? Is it the antigen or the PCR?
The antigen.
The antigen test.
Yeah, you come with a PCR, but you do the
antigen. And when you are departing, you do the PCR, and you don't have to do antigen before you depart.
But the departure, let me stress this, is dependent on the airline protocol and the destination's country's requirements.
Right.
You get it. So it's important that the passenger finds out from the airline because it varies. Because maybe the protocol for KLM might be different from protocol for British Airways.
Right.
Same way, protocols or guidelines in UK might be different from guidelines in, let's say, in the United States. So it's important that the passengers find out the requirements per the airline and also the country's destination protocol.
Okay. Another question is, apart from the usual, what are the protocols, apart from the usual sanitizing your hands and face masks, what other protocols are there for internal travel in Ghana on air or by air?
All right, internal travel, domestic, the same. You wear your mask, sanitize, you observe social distance at the terminal. And when you're on board, it's same as international, you wear mask and you disembark. So the same protocols implemented at international are the same, only that you don't test internally. I mean, you don't have to test for COVID before you travel from Kumasi or Accra. No.
Right.
You just have to have the mask, sanitize, observe social distance at the terminal, and also on board you wear mask, same as on the international flight.
So to the obviously it's not your question to answer, but I'm just exploring the idea that somebody could easily be positive and hasn't got any reason to travel externally and could just be traveling from Accra, Kumasi, Tamale and be infesting anyone on board, right? This is it's only my comment on that, but I can understand why internal travel, because they are normally short distance travel, 25, 30 minutes, 40 minutes. So perhaps maybe we can look into that with the appropriate channels and make some comment with them. Thank you very much for that clarification. We will take a few minute break. Everybody's testing, including myself. We will come back for 15 minutes and we will bring this to a close. But yes, we will take a few seconds break and we will come back.
Enjoy some fabulous rewards. Get a cool £10 reward when you receive £100 or more from the UK. Tell your friends and family in the UK to send money to your mobile money wallet or bank account using Express Pay and get an extra £10. Terms and conditions apply.
Welcome back again. At this point, I'm going to have to obviously mention my partners in this program, Ghana Nurses Association. We've all worked together to deliver this session and previous ones, and we have a lot more to come. The Nightingale Nursing Association UK, Western Region Nurses Association UK, and Ghana Union. We also want to thank the support of Express Pay Money Transfer. You are getting £10 for anything you send to your loved one. I'm sure they will make a good impact in their life. If you are sending money, log on to ExpressPay, and it's so fast and simple to use. We also thank the Ghana High Commission and Omega Life for their partnership, and for all the audience for staying through with us throughout the program. At this point, I want to also share with you our next program, which will come on in 2 weeks from today. It will be about, our next program will be about COVID-19 impact on women's health. Impact of COVID-19 on women's health. So the topic will be addressing obstacles. Yes, as is on your screen, we'll be looking into addressing obstacles to good gynecological health in the Black ethnic minority communities. As we all know, it's been 1 year. Some of you have not even had the chance to see your GPs or any clinician face to face. I, for instance, anytime I call my GP, all I get told is, you have to book it by phone and all that. So I'm sure this expert will come and help our mothers, our sisters, our loved ones who have issues, concerns that they may want to ask this expert. I think at some point we'll look into men's health as well and find the expert to address certain issues around men as well. So we are not only taking one side. But next 2 weeks, on the 9th of July, we'll be looking at impact of COVID-19 on women's health, and the topic will be to address gynecological health in Black and ethnic minorities, how they can access or the obstacles facing them in the midst of this situation. Thank you very much. So I'll go back to my Q&A again for a few minutes, and we will now look into rounding up. I have one or two questions which I want to ask there. Now, somebody wants to know, do I still have to wear a mask and social distance after I've had two doses of a vaccine?
obviously.
I'll take that. Yeah, definitely.
Uh,
Yes.
some questions that may sound simple, but it's worth. I mean, somebody
Yeah.
wants to know.
Yeah, it's because the evidence. Well, I think we're picking up more and more evidence that once you've had 2 vaccines, you are less likely to catch COVID, and if you do catch it, you're less likely to transmit it. So, they're thinking about it, and they're doing lots of social experiments to see how this can be played out. So, for instance, we've had a few mass events at the football stadiums, but before people go, they have to have tests, and then they have tests afterwards, and they work out if there was transmission during the events and things like that. So slowly, as we gather evidence around transmission, we'll soon be able to take off our masks. But then again, it all depends on the uptake of the vaccine. And then I want to say this, people really need to consider, because, come July 19th or whenever, when we do stop the social distancing and probably stop wearing masks, those of us who are not vaccinated will still be at risk of catching COVID. And, you won't be protected. You could catch the disease and have it mild. You could catch it and have moderate symptoms, or you could be hospitalized or unfortunately die. Or even if you go into hospital and come back, you could have long COVID symptoms that would affect your life going forward. Your health might not be the same. And the worry, especially when it comes to young people, maybe we, the older ones, we've been vaccinated, and we know the young ones might have less symptoms. But, as a mother myself, when my children had COVID, I really worried, because I didn't know what the outcome would be for them. And I think the stress, the whole family had it, but the stress I think I experienced was worse than the disease because I was just worrying. And, if your loved ones catch it, the stress itself is just, overwhelming, because you just don't know what the outcome is. So I would say, really consider, if you've not been vaccinated, to get it, because then you don't have the worry. If you're vaccinated, you'll be more relaxed, because you feel that at least I have some protection. Well, that's all I have to say on that point. Anyway, thanks.
Thank you. I don't know if Dr. Sbarro want to add to it, or you're quite okay with that, so that I can move to the next one.
Yeah. No, I mean, the only thing I would add is that the mask is not a substitute for social distancing and hand washing. So yeah, it's all three of those things, as well as fresh air.
Thank you. So somebody wants to know, why aren't some health workers getting the vaccine? As we are encouraging others to do, why do we still have resistance within the health system itself that is supposed to encourage us?
Yeah, it's a difficult question, that really, isn't it? What you've got to remember is health workers are just a small section of society, and just like other members of society have choices and may not trust elements, then healthcare workers are the same, really. There's been a massive push in terms of Black and ethnic minority people to increase the uptake in this section. And similarly, in healthcare workers, there's talks about mandating the vaccine in care home staff at the moment. And I'm not sure, from a personal point of view, I'm not sure that's the way to go. I met many people that have been skeptical or hesitant about the vaccine. And from my experience, the best way to approach these types of people is to have an honest conversation about the pros and the cons and let them make their own decision. And a lot of people have changed their minds as a result of those conversations. So I'm not sure it's a good idea to mandate the vaccine, but there is talk about that, particularly in certain healthcare workers.
Thank you very much, Doctor. We have another question here. Somebody says that the vaccines were developed so quickly. How do I know they are safe? As we've had HIV for years and there's been no vaccine to clean it up. And within a year, we've had a vaccine to clean this one up. Right.
I'll answer that one. So HIV actually affects your T cells, which is part of your immune system. So it's been very difficult to develop a vaccine against that. Now, when COVID infects you, you generate antibodies and then later on you generate the T cells and the B cells, and they sort of fight the infection. So if in HIV, if your T cells that should fight the infection are affected in the first place, then you've got nothing to support you. So they're completely different diseases. And that's why, and thank God for that, because otherwise, we would be battling something as difficult to overcome as HIV. And that's the reason why, it was easier to produce a vaccine against COVID than it has been with HIV.
Thank you. I will come back to Mr. Eric for one or two, please. There is one question about, I'm sure you mentioned it in the course of your presentation, but I think for those who join in later still want to know. What about somebody who has dual nationality, a British passport with the Ghana green card, not Ghana passport? We have the dual nationality card. Some people do have that. What would they be? So what will happen in those cases when they arrive in terms of payment?
Okay, with a green card, I will have to find out from immigration and revert on this question. But if it's dual citizen with the British passport and a Ghana passport, that one I know you pay the $50. But for the Ghana green card, I'll need to revert.
Right. Thank you so much. And somebody wants to know if you could kindly share with us if your document that you use for your presentation is something of public domain, if we could kindly have a copy and share it on our site so they can go and have a look. Is this something we can discuss that maybe after this program? If it's something that is within in the context of sharing with the public, then I'm sure we should be able to put it on the awareness forum and people can go there and have a look. Thank you so much, my panelists, for this evening. Yes, did you want to say something?
Yeah, for the updated COVID guidelines for air travel, it's on our website, but I can get a PDF for you so that you can email it to your members.
Okay, contact. Thank you so much. I think that will be very helpful for us. Thank you very much. This evening it's been a great pleasure having you, Dr. Abdul Zabaru. Thank you very much for your time. We know how valuable your time is. It's time that could save life, and you have come to save more lives here on this platform on many occasions. Therefore, what would I say? Thank you so much. At a lot, within a matter of days of call, you agreed to come again. This is your third, if not fourth, to be with us. I am very grateful. The Platform Awareness Program is very grateful for your continued support. We know that we do this for humanity and for our country, and we thank you for the knowledge and the skill you have brought to this platform. Eric Prempe from the Ghana Airport Authority, we are grateful for sharing with us your knowledge and experience as a customer service manager at the Ghana Airport Authority. We owe you to Mother Ghana to make it easier for us when we get there, but the right things also need to be done. So we are grateful that you have come to explain to us, and we thank all the authorities who consented to your appearance. And I hope we have been very kind with our conversation with you, and hopefully anything else that is left to be answered, you can get back to us and we will give them the information. To the audience, we thank you all for joining us. This is how far time will allow us to stay with you. Thank you very much for being prompt and continued support with this community awareness program. To our partners, Ghana Nurses Association, Ghana Western Region Nurses Association, and Nightingale Nurses Association, Ghana Union Executives, and Ghana Union Harlow, all the Ghanaian community organizations that support this program, we thank you for being part and continuous patronage of this program. We will come back to you in 2 weeks' time, and on this time it will be about women's health. So encourage as many of them to log on. And it might well be that the men will want to also hear and help educate our girls and our daughters and our, there's nothing like a woman's job when it comes to family life. So we all have a role to play. So we can all join in 2 weeks' time on the 9th of July, same time, 7 p.m. BST, and we will continue. Until then, my gratitude to all of you, and thank you very much. Be well and stay safe. Thank you very much.
Enjoy some fabulous rewards. Get a cool £10 reward when you receive £100 or more from the UK. Tell your friends and family in the UK to send money to your mobile money wallet or bank account using Express Pay and get an extra £10. Terms and conditions apply.